Okay, so I have the incredible pleasure of welcoming the next speaker, Professor Peter Drobac. I'm looking for the long list of his accolades, which I am not going to read all of it, but delighted to welcome Peter to the stage to share with us what his understanding of who is going to shape the future, how is innovation going to help us shape the future. Peter is a global public health specialist and a social entrepreneur. He's executive director for the Skoll Centre for Social Enterprise at the Said Business School. And besides that, he was also the first executive director of the University of Global Health Equity in Rwanda. And he works at the intersection of health, education, and technology. And a lot of his work goes around systemic leadership, systemic change, and that's the work that he does at the business school. And so I'm excited to welcome Peter. And if you haven't checked out his blog, Reimagine, it's one to really watch. And as we set up the IT to get the slides up, I would welcome you to get us started. Please join me in welcoming Peter.
Thank you, Anne. I feel so underdressed next to you. Great to see you all, and I'm really honored to be here today. Is anyone familiar with Dr. Paul Farmer? He's a well-known global health pioneer, right? Passed last year. A good friend and a mentor of mine. Once upon a time when I was young and still in my medical training and kind of coming up and just starting to work with him, I got invited at the hospital I was working at to give a talk on global health. It's kind of the first time I was asked to give a seminar, and I was really excited and honored, and then I looked at my calendar and I was like, oh, I'm not sure because Paul Farmer's giving a lecture then and I really wanted to go see it. And they said, yeah, actually he canceled and we couldn't find anybody else, so we're wondering if you can do it. And they changed the venue from this massive auditorium to a small broom closet, and I went and gave my talk. The reason I tell this story is because it feels much the same trying to follow Paul Farmer as it does following my friend Watu. We're working on slides. In the meantime, I'm just going to talk, if that's all right. This is going to be a little bit different. I know this is a research-focused, I'll stay near my microphones here, a research-focused conference. I'm not going to talk about research per se. I'm going to talk about innovation, and I think that everything that I will speak on today will very much apply to research. And think of it more as a provocation than a research talk, if you will. And so the title of this is Who Creates the Future? Reframing Innovation. As Anne mentioned, I am currently at the Skoll Centre for Social Entrepreneurship. We're based over in Said Business School, but work across the university and across the world. In fact, the reason I was late today is because we run a social innovation competition for students at universities all over the world, about 70 universities, who choose an environmental or social challenge in their communities that they care about, and then use systems-led innovation to try to come up with new change ideas. And we've been having a semifinal, a virtual semifinal all morning today, and are about to bring some of them here. So again, apologies for being late. What we do at the Skoll Centre is try to make social entrepreneurship a force for good in the world. We do it through teaching, including in collaboration with Alfox, through research, and through community building. Now, when you think about social entrepreneurship, you might think about social enterprises or people who are starting social enterprises or social businesses. And that's not incorrect, but we take a much more expansive view of social entrepreneurship. So to start with, and just to get technical on definitions for a moment, what do we mean by entrepreneurship? You might say entrepreneurship is, starting new businesses, etc. The classic definition of entrepreneurship is the pursuit of opportunity beyond the resources currently under your control. That was Howard Stevenson at Harvard Business School once upon a time. I'll just go without slides. We don't really need them. The pursuit of opportunity beyond the resources currently under our control. That's broad, right? That doesn't say anything about starting a business or anything else. It's, I see potential. I see something others don't see. I don't have the means to get there right now, but we're going to figure it out and we're going to build the future, right? And then adding social to the front of it is referring to the primacy of a social or environmental challenge. And so it's just that my primary goal is to make the world better. If I do that through a for-profit or a not-for-profit or whatever, it doesn't matter. These are all a means to an end. And that end is leaving the world a little bit better than we found it, or solving a stubborn problem, ideally at the root cause. So social entrepreneurship for us is about being entrepreneurial and being a change maker. And that's the way that we approach our research and our teaching and other kind of things. Now, obviously, innovation and creativity along with, with grit and other qualities are really integral parts of entrepreneurship. And that's what I'm going to talk about today. I won't harp on COVID, though I'm a public health person and could easily harp on COVID. But one of the things we've seen over the last couple of years, I think there are two really important lessons from the last few years that we've all lived through. The first is that our systems are fragile. And systems are invisible until something goes wrong, right? You can go back to 2020, the first time that maybe one of us walked into a supermarket and found the shelves empty and there was no toilet paper and stuff. First time you really thought about where does all this stuff come from? You just kind of take for granted all the steps and all the things that have to happen to bring that there. And I think that's a good metaphor for what we saw happening not only with our health systems, but with our education systems, with our economic systems, and with so many other things. So these big systemic crises are issues where we have complex systems that we take for granted. They're actually maybe not fit for purpose anymore, not in a decentralized, interconnected world, not in a deeply unequal world. The racial justice reckoning triggered by George Floyd's murder and the Black Lives Matter movement, another example of a deeply rooted systemic challenge that was clear and present to those who were on the receiving end of that problem, but for many others it was kind of a wake-up call of the insidious way that this issue is baked into so many aspects of our society, right? So we're now living through, some people call this year the 3 C's, COVID, climate change, and conflict, referring to the conflict in Ukraine and elsewhere. We got big systemic problems, and we can't go back to the way things were. We need to try to move forward, and at least there's a recognition that these kinds of issues can't stand, right? And we need to do something different. So this is about building the future. And to build the future, we need innovators and we need innovation to do that. So what is innovation? Again, definitionally, according to the Oxford English Dictionary, it is developing an idea or a new product or a new technology, right? It comes from the Latin innovare, which means make into new. So it's just about building, making, dreaming up, creating new stuff. And we think about innovation and entrepreneurship and where it comes from. If I had my slides here, what I would show you is a map that I'm sure you've seen before, which is COVID vaccine distribution around the world at the end of 2021. So a year after our amazing colleagues here and others developed these remarkable vaccines, where had they gone? And how many vaccines per 100 people had each country given by that point? And you won't be surprised to know that you would find that the countries in the north, like in North America, in Europe, etc., were very, very, very dark green, meaning there were a lot. There were at least 2 vaccines per person already administered, generally by the end of 2021. We also know that some countries, like I'm going to pick on Canada here because they're so nice, but Canada bought 6 times more COVID vaccines than they could ever possibly need for their population, just in case one proved to be better than the other or whatever. And look, they were looking out for their people, and if you're a politician, that is your duty to serve your constituents. But the other side of that map is, on the continent of Africa, it was almost not green at all. It's supposed to go from dark green to light green. It went from really, really light green, so faint you weren't sure if it was green at all. We know this, and we know that even those who needed vaccines the most, the sick, the infirm, healthcare workers on the front lines, weren't able to get access to those vaccines. So sure, we didn't have enough, but we had a lot. But look what happens, right? And this is one of those examples of where the world shows its true colors. We can talk about everyone being equal. We can talk about equity. We can talk about this being a global public good. And huge credit to the Oxford team who partnered with AstraZeneca because they would make an equitably accessible vaccine. But that was really the exception to the rule, right? So this map that shows this concentration of benefit of the fruits of scientific innovation being concentrated in wealthy countries in the global north. In this massive disparity, you could take the heading off of that graph and you could apply it to almost anything, right? in many ways. And it's something that we've seen over and over and over again. And I could bore you with data that shows, if you look at the number of patents, if you look at the amount of investment going into startups in the social or technological space, et cetera, we'd see much the same kind of disparity, right? So there's a huge issue there. And in many ways, the innovation ecosystem is replicating all of the sort of colonial and neo-colonial patterns that we've seen for decades in international development and in many other ways in the world. And if you look around at the literature on, for example, on international development, on many other issues, on the SDGs, what you often see is this notion that, yeah, we have big problems with inequity, the vaccine issue being a great example. We need to fix that. We all agree it's the right thing to do. How are we going to do that? Let's innovate. So innovation is a force for equity. I call that the conventional wisdom. And there's a lot of truth in that, right? We know that sometimes something that we invent for a city in the UK or the US may not be fit for purpose or affordable or accessible or whatever in other places. So maybe we need to innovate. We need to make incubators for premature babies out of spare Toyota parts, so they're cheaper and can be replaced in resource-limited last-mile communities. That's great. I know a lot of folks working on those kinds of things. A lot of folks in the room here working on these things. But I would argue that it's not enough. And that we actually need to flip the script. And this is the reframe that I'm talking about. And to me, the idea is it's not that innovation is a force for equity, that equity is a force for innovation. And that's the thing I want you to think about and stick with. Early on, this is actually before I was even in medicine, but Paul Farmer and others were working in Haiti, and they had started a little clinic in rural Haiti that was providing free care for tuberculosis, which was the biggest healthcare problem facing that community at the time. So you can get diagnosed for free, you get treatment for free, the drugs for free, everything, because they realize an incredibly impoverished community, we're going to give you state-of-the-art care. Same care you would get, same treatment as you would get at a hospital at Harvard in the US or something. And a month into that program, when they started this, 3 people who were young people, like in their 30s, died of tuberculosis, despite having been started in the program. And they had an emergency meeting, and they got everyone on the project together to talk about what's going wrong. Why is this program failing? We're given all the right stuff. We're following all the clinical protocols. We're giving everything for free. And what most of the folks who looked like me or had my level of education, I mean doctors, etc., said things like, well, the issue is the patients are ignorant and they need to be educated more because they're maybe not following the instructions I gave them. They're not doing the right thing. They're not following our orders, etc. They're very traditional and they go to traditional healers, etc., etc. And we had some community health workers who were outreach workers helping out as well. And they, after a while, nervously kind of raised their hand and said, well, actually, the real issues that we're seeing is that they're too sick to walk 6 hours to get to the clinic. Or, they don't have enough food to eat and they can't keep the medicines down. Or one of their mother is too sick to come in, and so he's splitting his pills in half to share them with his mother. Right? And so that kind of proximity and that lived experience gave an insight into why the system and the program was failing. And ultimately, the decision went with the community health workers and said, okay, we need design interventions to address those things. And what that led to was unsexy but really powerful innovations like what we now call social prescribing. There's a paper from 1991, this is a research conference, in the Annals of Respiratory Medicine that entered the term into the scientific literature of donkey rental fees. So if you were too sick and you lived really far away from the clinic would hire a donkey to bring you in again. This is a very remote area. That's an example of innovation that's coming from the community out and based on one's lived experience. I give you a million examples of this. So the concept that I want to share with you today, and some of you are probably familiar with this, but I think goes at the heart of so much that we're talking about here today, is what we call knowledge equity. And we work with our friends at the Center for Knowledge Equity in London. They've taught us a lot about this. You know what equity is? Knowledge equity then is exactly what you would think. It's the recognition that, first of all, there's, as my friend Baljeet likes to say, there's a Malala and a Mandela in every community. It's just that we are not reaching them or allowing them to reach us, right? That fictional map that you have in your minds that I told you about, if all the patents are coming from these few places and mostly from people who look like me, there are a couple of explanations for that, right? People who look like me are the smartest and the cleverest and the luckiest, or our systems are messed up and give a lot of benefit to people who look like me and a lot less to other people. And so what we're doing when we face these really big grand challenges is a massive proportion of the 7 billion people on the planet and all that talent and experience and expertise and inspiration and creativity we're effectively letting go to waste. So knowledge equity is the idea that all forms of knowledge, not just the kind of learned expertise that we get in the august halls of a place like this, but also our practiced expertise, from our work, and also our lived experience and lived expertise, particularly those who are living with the problem we're trying to address, are so important. And all of those things need to be valued. How are we doing on time? I'm extemporizing here. 1 minute to go. Okay, I'm getting there. All of those things need to be valued. It forces you to look at who are the knowledge producers and who are not. Who has access to the knowledge and who does not. Who benefits from the knowledge and who does not. And so my experience with examples like the community health workers in Haiti is that so often it is in fact those with lived experience who bring tremendous new ideas. And we don't need to prioritize one over the other. We need to embrace it all. Imagine if we could have, we have a knowledge equity fellowship at the Skoll Centre that brings lived experience leaders into the academy and works together with academics on research. I know AFOX is doing a lot of work like this as well. You bring all that stuff together. Walter Isaacson, the biographer, wrote this terrific book called The Innovators. The Innovators was the history of computer science innovation from Ada Lovelace in the 19th century through Steve Jobs, Bill Gates, etc. And I saw him. He was running the Aspen Ideas Festival or whatever. I saw him right around the time the book came out. He was chatting about it, and I just had a minute with him, and I said, so what's like the core idea? What's your tweet-length summary of your book? And he said, innovation is about getting people with vastly different kinds of expertise into the same physical room to solve problems. I think he was referring to different kinds of disciplines, right? Art, science, etc. We're good at that in a university like this, but then broaden that and say vastly different worldviews, vastly different incentive structures, vastly different kinds of expertise. And when we start to harness that, we have the potential for something really powerful. So my argument to you in closing is that equity can drive innovation because it brings new ideas into the system, number one, and that also it forces us to think differently. There are so many problems a lot of us in this room are working on where people are saying, it's not possible because it's too hard, it's too complex, it's too expensive, it can't be done in that place for whatever reason, right? I faced this for my entire career working in health equity. And when you lead with an equity agenda, the idea that, for example, in healthcare, anybody, anywhere, no matter where they're born, how rich, how poor they are, deserves access to decent healthcare, the same I would want for my mom or my grandmother or my kids. You can't just say, gosh, they just don't have enough money, it's too expensive, it's too hard, it's too complex. You're forced to say, okay, how do we get there? And so that opens up a new universe of possibilities. And then finally, the kind of inclusive nature of an equity or knowledge equity approach builds the kind of trust and social capital that you need to create the conditions for real change. Think about all of the times, we get this, we see this in academic collaborations, we see it all the time in development, where these big deficits of trust because of the way the system has been for so long. People coming in, I have a great idea to solve your problem, and then leaving after 6 months when the grant runs out, all that other kind of stuff. Being there, being on the ground, working together, valuing everybody's expertise equally creates the kind of conditions that you need to create truly transformational change. So I challenge all of you to think about how you can incorporate a knowledge equity approach into your work, and particularly into research. We do a lot of great things here at Oxford, but this is an area we could do a lot better and, in fact, be a leader. Thank you very much.